It's 9:18. We're headed down into the cellar where the doors just opened on its own. Give us a sign that you want to communicate with us.
Broadcasting from the darkest corners of the Pacific Northwest, this is Transcendence.
Now you will receive us. Do not ask for your food or you're hungry. We do not want you tired and sick. It is your corrupt we claim. It is your evil that will be sought by us. With every breath, we shall hunt them down, 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 down.
The power of Christ compels you. The power of Christ compels you. The power of Christ compels you.
Out of my way. People have to be told.
You know I can't let you do that.
What are you guys?
Well, we've been called ghost hunters, paranormal researchers.
But we prefer to be known simply as
Emma Strange and Charlie Ripley.
It's Corona time. Hey, it's Corona time right now. It's Corona time. It's Corona time.
What's up, everybody? In the news today, coronavirus. And that's what we're going to be covering today. This is Charlie Ripley.
And I'm Emma Strange.
And we're going to go into a little bit of the events about what's been happening, what's going on, some conspiracies, the 100-year curse.
Yeah, so we hopefully, as you are listening to this, you are healthy. That seems to be everybody's primary concern nowadays, as that's, pretty understandable considering what we've got going on. So part of our job in having a platform like this is to be responsible in reporting accurate information to the best of our ability. And as a lot of you guys have probably seen in the media, there is a fair amount of fear-mongering going on.
Spoiler alert, this will not be fear-mongering. This is just going to be reporting as many facts as we can, as well as some speculation, but we're not here to tell you that it's the end of the world, and we're not here to tell you to go, stock up on piles and prepare for apocalypse now.
No, we don't want to incite more panic because the media is doing a great job of that all on their own. So like some of the information you're going to hear today are rough estimates because, as we know, records weren't as capable of being recorded and preserved as well as we're able to do in the 21st century. So we want to encourage you to do your own research and utilize common sense and critical thinking skills. We live in a society where everything is spoon-fed to us and misinformation spreads like wildfire. So
this is our blanket disclosure.
Yeah, it's a dangerous thing. So, do your due diligence, research, learn, and don't get all your news from one source. So, just because we say something, I have vetted most of this research. However, I'm getting a lot of my same information in the same news outlets that everyone else is. So, just read. And so we're going to go ahead and get started here.
Health officials with the CDC say it's not a matter of if, but when a coronavirus outbreak hits the U.S.
Don't panic. There are simple things you can do right now to help prepare. The Department of Homeland Security says stock up on medicines for yourself and your children, like pain relievers, cough and cold medicines, even medicines for upset stomach. And don't forget those fluids that contain electrolytes.
Government officials also say make sure you have a supply of any regular prescription medicines you might need.
And don't forget, it's important to store a 2-week supply of food and water.
That means canned and non-perishable food and enough bottled water for everyone in your family. Some experts suggest stocking up on soap, detergent, and baby supplies to last at least a month. That way you have what you need if there's any disruption to the supply chain.
And if you're often out in big crowds or you ride public transit, consider carrying wipes or using a disinfectant spray with alcohol. And use it often.
And what about masks? We found some online vendors jacking up the prices, preying on people's fears. This seller peddling a box of 10 masks for $299. And this person hawking a 10-pack for nearly $700. But do you really need to stock up?
I'm here with Dr. Natalie Azar. Dr. Natalie, what's the bottom line on masks? Are they helpful?
So, Vicki, the bottom line right now is that there is no recommendation for anybody in this country to wear a mask to protect them against coronavirus unless you are exhibiting symptoms yourself, are sick, or are taking care of somebody who is sick.
Dr. Azar says the N95, a specialized mask, does protect against the coronavirus, but the CDC recommends preserving those masks for frontline healthcare workers.
Should you worry if you can't get one of these N95 masks?
Unless there's a widespread community outbreak, this is not something that Americans necessarily need to have.
And another thing, health experts say some people have overreacted, avoiding Chinese restaurants and businesses out of fear that is baseless. Coronavirus is spread by saliva, coughing, sneezing, or direct contact with people who are sick.
At the end of the day, what is the number one thing you can do to prevent yourself from being sick?
Right now, I think the number one thing that people need to do, which we tell people for flu anyway, is to wash your hands. And we mean 20 seconds, really scrubbing. That's how the germs are going to get off of you.
And Dr. Azar says if you develop a dry cough, fever, and shortness of breath, don't wait. See your doctor.
And if you have children, ask if their schools have a plan for what to do. If there is an outbreak, are they considering things like online lessons if kids have to stay home or any other measures? And one of the biggest germ carriers, you all know this, but this is something we all carry around, is our phone. So the key here, wipe it down often. You want to use wipes that have alcohol. Let me pass those out. Sure. Here's the thing, too. Don't take this with you when you go to eat. That's something people have. You know, because you're going to touch this, you're going to touch your food.
And also, sometimes someone will hand me their phone and I'll take a picture, you know, or whatever.
I see you do that a lot.
We do that a lot, so that's a no-no. By the way, who is most susceptible to getting this?
We're always talking about the elderly, the young, people with compromised immune systems.
These
That's
are nice
the other
wipes.
thing. Yeah, these are not bad.
And it's not going to mess up the. I thought you were just doing your face.
The best thing you can do is really the easiest thing to do is wash your hands.
Exactly.
Wash your hands, but really scrub them. Yeah.
20 seconds, get all the germs off, and do it frequently.
They get it under the nails and stuff.
Yeah.
Does Purell's work as good as soap and water, do we know?
If it has 60% alcohol, that is going to kill the coronavirus and the other germs that cause flu and other bacteria. So that's the key, is making sure it has that 60% alcohol.
At dinner time, you have 60% alcohol.
Dip my hand to the wine.
Thank you.
Okay, another myth. A lot of people think people get sick because the temperatures keep going back and forth. Not true. And in fact, hold on a second.
There you go.
Anyway.
So that is one of very few interviews that I found that actually had accurate information on it. That wasn't being like, oh my God, this is doomsday. We're all going to die from the coronavirus. So,
I'm muted. I believe I'm still muted. Oh, no. Okay. Never mind.
JK. No.
Ironically, in that interview, they said to stockpile up on certain things. And in our news today, at least here in Oregon, a few of our retailers are not allowing you to stockpile. They do not allow you. I think they said it was either Winco or Costco put a ban on a certain amount of cleaning supplies and other things. No, there was another one. So
was another one?
I think it was Costco, maybe Winco. Not 100% certain on that. They're saying you can get a limited number and that's it. So they don't want to create those situations where those vendors were selling 10 masks for $700.
Right. I know we were at Fred Meyer this Sunday, and I was getting some sanitary wipes and stuff for other reasons, but they were almost clean out of everything, and I had 3 or 4 other people behind me waiting to look at the disinfectant wipes and disinfectant in general. So yeah, we've already gone into that territory where people are hoarding and panicking.
And they brought up another really good point, and I've been hammering this home to everyone when they ask me about it. Do you really think it's that big of a deal? Do you really think it's going to cause problems? They specifically said the supply lines. So a lot of places in America are food deserts where they don't have grocery stores and other things like that are close by. And America as a whole thrives on the truck industry and having access to supplies constantly coming in. If for whatever reason trucks can't come in or out of the state, even for a couple of days, that's going to cause widespread shortages and problems. So it's really important to remember that it's not just they're going to run out of supplies. No, there may be plenty of supplies, but they might be, in the middle of Iowa and on a truck that can't get in, and that's another problem.
It's one of many problems right now. So, barring that news article aside, do we want to start at the beginning here, or do we want to just tackle each topic individually, or what do you want to do, Charlie?
Yeah, let's start at the beginning. There's a really good documentary I think that we're going to reference a few times, or I guess it's technically a report shot like a documentary from like ABC News that we watched. So
it's one of a couple. That. Yeah, I was watching another one not too long ago that centered more on Wuhan too. But so if you've been living under a rock and don't know what the Wuhan virus is, or COVID-19, or the coronavirus, it's got like a million different names right now. So at this point, we can only speculate as to the origins of the coronavirus. Health officials are looking from like bats to pangolins, and I really have no idea if that's how you pronounce that animal's name, but so don't shoot me.
Like armadillos.
Pretty much. They're really cute too, actually. But the biggest theory as to how it originated is the result of people selling illegal wildlife in a market located in Wuhan, China. So the market in Wuhan, which was closed down after the outbreak, had a wild animal section. So they kept live and slaughtered species that were on sale, including body parts of like camels, koalas, and birds. And then they had a live section. So that we had like wolf pups, scorpions, bamboo rats, squirrels, foxes, hedgehogs, salamanders, turtles, crocodiles. So you had a pretty like wide variety of things there.
And that's not completely unheard of. I mean, unfortunately, the animal trade is still a huge problem in the world, introducing invasive species into homes where they don't belong because, you know, people want to have their exotic pets. I think Netflix is going to get a documentary in the next month, I want to say, that follows, I think it was El Chapo, some Colombian drug lord. It follows his three animals. It was like a hippo, a giraffe, and a tiger or something that they rescued from his compound that may or may not have been hooked on drugs.
Okay. That's news to me. Is it really that? Like, I know it's a problem in other parts of the world, but like as far as like Western culture goes, do we still experience a lot of that, like poaching? And
I mean, there's probably not a lot to poach here when you compare it to like elephant ivory or rhino tusks, but I mean there's still a fair amount of people who want to own exotic animals here, especially I'll reference Netflix again. They have documentaries about snake handlers who, for some reason, want like the most venomous snakes, the most beautiful, pretty, and also most deadly snakes, and they keep them in cages. I'm sorry, it's going to be an off tangent, but this is horrifying. We watched a long time ago. I don't know if you remember. It was like 8 years ago. We watched a girl who lived in a trailer, like a small one toilet, small kitchen / dining room and bedroom trailer. Had like 19 cages full of snakes there that just had like one lock, and she accidentally left it unlocked and it bit her and it turned all of her blood into like water and it poured out of her.
Jesus.
So
no, I haven't. I don't remember that. No.
I'm pretty sure you can own foxes in some places legally in the United States.
I think you have to have permits. Like I see on YouTube and TikTok all the time that people have pet foxes, and they're so I learned cute. They are, but like I learned what the fox says, and it's just like this really high-pitched screechy sound, and it's kind of cute, but like if you heard that in the middle of the woods at like 2:00 in the morning, you just fucking nope out of there. So it's
like owning a cat. But that's the problem, is that they're really cute, so people want them. People want their pandas and their foxes and the ocelots like Archer, Babu. Okay, back on topic.
Okay.
Tainted meat.
So yeah, it started on like they had the first confirmed, like they knew shit was hitting the fan on January 23rd. Wuhan went into lockdown. The main thing I want to touch on here, because again, all of this information has been spreading across Fox, NPR, it was just everything. So we're not going to get into the nitty gritty of all of that, but I want to touch on just the human right violations that are going on in China right now. And so Charlie has seen more of this like on Reddit pages and a bunch of other different sources about the shitstorm that's going on in China that is separate from this.
So, excuse me. So the two big ones that I spent some time looking into and researching and seeing, one appears maybe to be a hoax. So this one's pretty unconfirmed, and it seems to be actually more confirmed that it's a hoax that people were talking about, that like people were making a break for, running out of the quarantine zone and getting shot dead. You've probably seen the pictures flying around online of a man or a woman kind of dressed up like a jogger laying on their back. Reports are saying that was actually like an auto accident, and that people are just, they heard a loud noise, assume it was a gunshot, and kind of just took it and ran with it. And the sad thing is, I think we've touched on this before, that, things are so messed up in the world that you can believe anything you read. So when you hear, I heard a loud noise and we're in a quarantine zone, they probably shot someone, that's believable enough that it's probably true, and you start tweeting it, sending it out to the world. But it looks like that one is not true at this point. The one that does appear to be true, which is even worse, is the enforced quarantines. This building is quarantined off, so we're going to weld the door shut.
Well, that's not what I'm talking about, though. I'm talking about people who are revolting against the Chinese government. That's what I'm referring to right now.
Oh, okay. Sorry.
No, it's okay. We're going to get to the Wuhan stuff.
Conspiracies. So that's kind of the main thing's kind of another side note of conspiracy. That's kind of where a lot of people are saying that this is a man-made virus. Was with those Hong Kong riots, and with the Free Hong Kong this was their kind of way of quelling those. They actually just started reporting again recently and showing up in force and in mass. So they're letting the world know that this has not stopped them. But the human rights violation, as far as that goes, there's like people being scooped up in trucks, forced out of houses, and just, we could do the whole show right here just talking about the human rights violations of China, and that would be a whole different topic in full.
Well, we watched a YouTube documentary that ABC threw up last weekend, and I watched another one by another company here. Let me check CGTN. That are showing two very different sides of what's going on in Wuhan. And it's one of those things where, again, media takes footage that they get and they spin it to have a better story, right? So I don't actually know whether or not the things that we're seeing are accurate representations of what's happening in Wuhan right now, because from the ABC documentary that we saw, they were going house to house, taking people's temperatures, and if it scored a reading that was above acceptable or under acceptable, they forced people out of their homes. They were literally dragging people out of their homes, whether they wanted to or not, and forcing them into quarantine, taking them to the hospital, taking them away from their families. And then we saw a little later on, as the virus got worse, they were welding people into their homes, like welding the door shut, like Charlie said. And so again, my heart hurts if that's true, but I don't know if it is.
It appears to be from, the videos you can see of people being dragged out of their houses. Those are very much real. Now, whether they're being dragged out for a quarantine because they're under arrest for other reasons, or there's a different story to it, the fact of the matter remains that people are getting dragged out of their homes, and that they're picking people up off the streets. We may not know necessarily why, though it's pretty easy to guess, but the fact remains that it is happening. And it's kind of interesting to talk about the human rights side of it, because and this will be something that's been discussed heavily across, what happens if America starts doing that? What happens if there's martial law, or you're being dragged out of your homes? And both sides kind of have a valid argument. Quarantines, any professional will tell you, quarantines are an effective way of dealing with something like this. If it can't spread, it can't spread. It's done. So it's the right thing to do for people. However, as we know from human nature, people don't like to be told what to do. They don't like to be locked away, and they don't like to be put in situations that they don't choose to be. So is it your human right to say, even though I'm sick, I'm going to expose the public? Or is it the human right to say, you forfeit your rights when you're sick for the betterment of the people? And that's a really hard line to walk. And of course, America's really split on that.
No, it really is. And like in that same documentary that we watched, you saw that the streets were just bare. They were empty. There was nobody. And in a populated country like China, that is just mind-boggling to me, to see like not a single person, or maybe like one or two in like shopping centers or just in the general public, which is understandable if like most of your country is under quarantine or most of your city is under quarantine, excuse me. And it's scary. And like you said, I don't know how the US would handle that if it was to the extreme that it is in Wuhan.
No, there's a lot of theories that float out there. There's people who always say, that they're going to, martial law, that they're going to roll with tanks in the army and force everyone into, camps and all that sort of thing. And of course, that's the extremist view. The more likely than not that won't happen, but there's varying degrees of that happening. And there's always the people who are like, yo, you're not going to get my guns. You're not going to get me out of my house, sort of thing. And therein lies the main difference between China and America. I think that the amount of people here with their, we'll call it vigor, are very hard to remove from their homes, very hard to force the people to do something they don't want to do, especially when you have as much freedoms and as much
many guns
access
as America does.
that America
right.
has. So that's a very different conversation for us than really anywhere else in the world. I hate to be that person who's like, America's unique, America's special, but that conversation looks very different here than it would anywhere else, especially also because people forget how huge the United States of America is. Controlling all 50 states and trying to work between federal and local governments is much harder than, a country that's a small country that can just, coordinate everything at once.
Right. And like, so we have the general populace that is obviously dealing with this, but then I watched a few things and saw a few interviews with healthcare workers that are over in Wuhan now. And obviously they are overworked and underpaid. And so everything, when you're working in quarantine, they're wearing your PPE and they're decked out in it. And they can't bring in cell phones or any kind of recording devices. So that footage there's not a lot of it, is what I'm trying to say. And one of the things I saw is that the healthcare workers there, the doctors, the nurses, they're not allowed to go to the bathroom or eat or drink during their 6-hour shifts that they're working there because, you have to take all that PPE off, and they have to get oxygen after that 6-hour period. So they leave after 6 hours, they take care of themselves for a little bit, and they just go right back into it. And so I guess a lot of the health facilities are giving them adult diapers because they're not allowed to use the restroom. So, hats off to our healthcare professionals in times of like crises like these, because I was working in the health industry when the bulk of the Ebola crisis was happening, and the amount of training that we have to go through and the amount of just the cojones you have to just going to work every day and being exposed to things like that is just, first responders, again, just phenomenal.
Definitely. And, that's physically hard. And that's, I would say even more mentally hard, because not only that, when you go home, you have to think, what happens if you bring it home to your family and you're the cause of them getting infected? Or what if you're working so hard that you fatigue yourself and now you've opened yourself up to the disease or virus and different things like that? It's really sad to see. And some of those doctors they're working hard and then they're getting infected themselves. And then, that's fighting a losing battle, right? If the first responders are the ones also getting the most sick, then that's also a bad situation.
I couldn't find a whole lot of information, but do you know much about how China's healthcare system is as a whole?
I don't know much about it.
Because around the rumor mill that I've heard that it's like worse than ours, which is saying something. So
I was going to say that's a tough benchmark to meet, but also I think it's unfair to put generalized statements like that. Any healthcare system, even the best healthcare and the systems in the world, are not going to function well when you're dealing with something you've never seen before.
Well,
right?
No, that's not what I'm saying at all. But like, if you don't have equipment, how do I say this? If you don't have equipment that's adequately prepared to deal with anything, like, so China, this isn't the first outbreak they've gone through. They've dealt with SARS like not that long ago. So as far as I'm understanding, that the coronavirus, this is also a respiratory illness too. So
right. They're very closely linked, from what I understand. In fact, someone had said that they're both considered a form of SARS, but I don't actually know if it is considered a form of it or not. But they are.
No, it is. It is. Yeah, it's like an off branch of it, as far as I was understanding when I was reading on the CDC website. That being said, though, so as far as how the coronavirus is impacting us here in Oregon, or the Pacific Northwest in general. So we've only had, as of today, I believe, there's been like a total of 80 cases here in the United States with a total of 9 deaths, like overall, and like eight of those I think were in Washington, or just 8 cases in total.
Last I knew, there was 6 deaths in Washington, and that was 1 or 2 days ago. So yeah, right. Washington has the majority of the deaths, and I believe Oregon has 3 cases. Yeah. 1 for sure confirmed and 2 suspected.
I thought it was the other way around, but
it might be the other way around.
And we have, specifically in Oregon, it's up in Washington County, so a little bit northwest of Hillsborough, I believe.
Mm-hmm.
Yeah. So, I mean, we haven't seen a whole lot of it here, knock on wood. The bulk of it is up in Washington. And then I saw that Canada, like near Vancouver, had a lot of more like reported cases today. But the map that I was looking at, I thought it was accurate. It keeps switching back and forth. So I can't say for sure now. But if you go to the John Hopkins CSSE, and I'll post these these links in the show links for the episode, so you can click those and see for yourself. But as of today, we're at 95,411 cases, and I don't know if the site glitched earlier today, because like when I refreshed it around 6 p.m. it was showing 2,647,665 infected. And then when I refreshed it right before we started recording, it was back down to 95,000. So I have no idea what happened there. But as we know, the bulk of those cases are in China, South Korea, Italy, Iran, Japan, and France, Germany, Spain are seeing an increase. Obviously, we have an increase, but it's not as much as the other side of the world. Of that, totally globally, we've only seen 3,285 deaths as of today. Bulk of those, again, are in China, Italy, Iran, South Korea. But anyway, back to Oregon. So...
Oh, hang on.
Yeah, go ahead.
Can you read the number of people who've recovered? We were talking a little bit about that in our research, and that's a good number as well.
So 53,255. Again, the bulk of those are in China.
Thank you. Okay, now continue.
Yeah, no, it's no problem. Let me look at the stats here to see if we have any. 276 of those are in Italy. Let me see.
Still, though, comparing those numbers, 95,000 to 3,000 dead, that's over 3% mortality rate. And
yeah, that's what we're sitting at about now. I think the World Health Organization is putting it between 2 and 3%.
Yes. And people, the thing about percentages that obviously, we all know through basic math is that it can be a small number. 3% of 100 is only 3. But if it was to infect, say the entire world's population, pushing on 8 billion people, 3% of 8 billion is a lot. So when you compare it to other things that have been, had much higher body counts, people also aren't factoring in things like the Ebola virus I just posted on Twitter today. The last case of the Ebola outbreak was cured as of today. So that was an ongoing for, I think, 16 to 19 months.
Was that here in the U.S.?
I don't believe so, no.
Because I have contradicting information on that, so I'll have to take a look.
Interesting. The point of it is that these things go on for a long period of time, and
right.
so...
And they're reoccurring, too.
Exactly.
So, let's talk Pacific Northwest. So, it also came out today that an Amazon employee was diagnosed with the coronavirus, and they shut down the one of the main offices in Seattle. I didn't get a chance to do a whole lot of research on it, but that is what I am hearing. So I saw a joke, and we know this is serious, guys, but it would, dark senses of humor keep us going through stuff like that. But seeing as there is an outbreak at Amazon, so technically the rest of us could get it by Thursday if we order within the next 2 hours, right?
If you have Prime.
Yeah, only if you have Prime. So, Oregon, though. So I work for the state. So I get a lot of emails from our governor, Kate Brown, and she sent out an email. Let me pull that up here, and I'm going to read it for you guys. So she sent out an email a couple days ago. It states, as you probably know, we have confirmed 3 presumptive cases of the COVID-19 virus here in Oregon. My thoughts go out to all Oregonians who have been impacted by this disease, as well as their families. What's happening here in Oregon and across the globe is deeply concerning, and I want you to know that my team is taking this extremely seriously. We're working day and night to contain the disease, and as we tackle this challenge, we will be open with the public and share information as quickly as possible. In fact, we announced the first confirmed case within just a few hours of learning the test results, and we've got about 20 other people who are waiting to confirm whether or not they have it as of March 4th. So anyway. So, Kate Brown has assembled a coronavirus response team to coordinate state and local response efforts. They're building on the work of incident management teams, which has been in place at the Oregon Health Authority since January. The agency has operated similar response operations in past efforts to address global health threats such as the H1N1 influenza, so the swine flu, Ebola, and then the Zika virus. So, and then she gives a few tips for preventing the spread of the coronavirus. None of it is different than what you heard in that previous news thing that we played. Yeah, please, Jesus Christ, wash your hands. And then she says, if you need more information, sign up for updates on the COVID-19 website and review resources available for the Centers for Disease Control. And then also you can get any questions about the coronavirus answered by calling the state's hotline by dialing 211. So that is from our governor. But I want to talk about some kind of sketchy information that I found out about Oregon and Washington's response teams with this. So the World Health Organization said that the state of Oregon is refusing to send out exact numbers to the World Health Organization. So they're not willing to report it because basically they said that we don't need to right now because that's private information, which is odd to me. And I was hoping that you would be able to maybe explain to me why.
Well, I mean, the CDC kind of did the same thing. A couple days ago, they announced that they were not going to be tracking individual cases as well. And then there was actually a big petition and everything. It looks like that was changed as of today. I can't give for sure reasons, but the first thought that pops to my head, and, I'm not a lawyer, but this is going to sound very lawyer mumbo jumbo, so it must be true. Would be like a HIPAA violation. If there's only 2 people in the state of Oregon who have it, then talking about them doesn't really protect them, even if you're saying, oh, well, the 2 confirmed cases, well, everyone will know who those 2 cases are. So there may be problems with that, as well as we all know I am a very outspoken person when it comes to government and such like that. I'll try and keep politics out of it. They're not always the most efficient thing. So it could be something like where they say, okay, well, if you have under 100 reported cases, then you don't get any federal grant money or any funding or no emergency responses. So it could potentially be a smart move to not report that, depending on how they're going to be doling out emergency supplies and aid and all that sort of thing. As I was just talking about a little bit earlier, the federal government has 50 states to respond to, so they need to have some way of classifying, okay, well, obviously the state that has 100 cases is in more need than the state that only has 1. So it could be a bid for just playing the political game. It could be something to do with like the CDC, or it could just be, HIPAA, or maybe I'm completely off base and that's just what they want to do for now.
I mean, yeah, those are all valid points. I also saw an article like right before we started recording about Kennedy and Brent Batchelor. They're a couple who live in Beaverton. and they had traveled to Tokyo and Seoul in late February for their honeymoon. And so as soon as like reports of this started coming out, they're like, oh, hey, we were around all of this crap. So, you know, there's a very high chance that we were infected. So they tried to get a hold of people to get tested. They started developing flu-like symptoms. They called a nurse's hotline that was operated by Kaiser Permanente. And the nurse put them on hold for a minute and then came back to tell them that since they didn't have a fever, he didn't meet the threshold for coming to the hospital to get tested for COVID. So basically, they didn't trust that information. They self-quarantined, and they aren't able to get any information from the state of Oregon on how to proceed to maybe possibly get tested. And I know that the equipment that you need for this is far and few between, and it takes a lot to clean. And so I get not wanting to prioritize, but I also found out that the Oregon Health Authority is not tracking flights in and out of affected areas coming into Oregon, which again is mind blowing to me. Like, why would you not do that?
Yeah, and just touching on the supplies are limited. That's my understanding of it, is like if you have 10 test kits and you have to make those last, for however long it needs to last, then you're only going to want to test the people that you're, most sure are going to be the most at risk, because each one of those that tests negative, either that's a false negative, you have to run it again, or that's a wasted test. So I think they did the right thing. They tried to do the right thing. They were told you don't meet the threshold, and then they did what was necessary, to keep themselves away from other people. So I think that's a good story. That's a nice, rational response. Hey, we think we have this. Sorry, we can't test you. Okay, well, to be safe, we're going to wash our hands and self-quarantine for a little bit. Happy story.
Which is irresponsible, because not a lot of people would do that. So I take my hat off to the couple who is, taking the precautions, staying home from work if you are sick. So if you, please, if you are not feeling well, stay home. And I know that the U.S. workforce especially is very punishing for that, because if you don't show up, you get hours cut, and cost of living's high. You got to pay bills. You have families to feed, and I get it. But this is part of a much bigger problem. And I just want to touch on what I feel is just like a lack of adequate response in Oregon and Washington especially. And I can't speak for the rest of the country, because I don't know. I've focused mainly on where we are, because this is what is affecting us mostly. So there was a tweet that went viral a couple days ago from a user called Into the Brush. She lives in Seattle. And so I'm just going to read through her tweets here.
I don't know if we should call tweets going viral right now. That might be a little insensitive.
Really? Anyways, so we're quoting here. I live in Seattle. I have all symptoms of COVID-19, and I have a history of chronic bronchitis. So since I work in a physical therapy clinic with many 65 plus patients and those with chronic illnesses, I decided to be responsible and go get tested. This is how that went. I called the Corona hotline and was on hold for 40 minutes and then gave up. So I looked at the CDC and Washington public health websites. They told me to see a primary care doctor, but there's no information about testing. I called 2 primary care doctors. One told me they don't know where to get testing and I should not seek out testing. The other one told me to go to an urgent care or ER. I called the urgent care. They also had no idea where the tests are, but told me to call the hospital. I called the hospital. They do not have tests, but transferred me to the COVID-19 hotline to answer my questions. Since I was transferred on a medical provider line, I actually got through. So, progress. The lady with the hotline was very kind and professional and understood my concern about my own health and those at my clinic, which is currently being sanitized. However, I was told I do not qualify for testing, and I was not given a timeline or info on current resources. So, who does qualify? Those who have been out of the country for the last 14 days and those who have had contact with one of the few people who had been tested and come up positive. That's it. So the only way that I can get treated is if my symptoms get so bad that I develop pneumonia or bronchitis, which is very likely in my case. Then I'll be in the ER and quarantined for several days while waiting for a test for the results to come back. It's all incredibly frustrating because I'm trying to do everything right in a system that punishes moments of weakness for taking days off, like we discussed before. And it's also scary to know that I won't be able to get help until I need life support. To sum it up, this is not contained. No one knows what the fuck is happening. I can't work. Wash your fucking hands. So, that to me speaks volumes about our lack of preparedness for this at the present moment. I don't know if Charlie has any comment there, but I don't know. That frustrates me as someone who has worked in the health industry. You would think the U.S. would be a little bit more on point with what information they have available instead of like throwing people around the ring.
Oh, yeah, definitely on that. But we also, as we talked about, there's a lot of misinformation and a lot of media hype storm around it. So it's hard to get reliable facts as well as, you know, what that person just described is like, you know, the American experience, right? You fall down on your arm, it hurts. You take a Tylenol, you go to bed. You wake up, it's still swollen, it hurts. You say, I'll give it a day or two. And then, you know, when it's finally like, okay, now the pain is spreading and it's not going down, I'll finally go to the ER on day 5. And then they tell you, hey, if you would have came in day 1, this is no problem, but now it's infected and there's other problems. And, you know, you go at the last moment when you absolutely have to. And then it's much worse than if you went in the beginning. In a perfect world, everyone would be screened, you know, or go to the hospital and be checked out and be told they're okay. But we just don't have the resources for that, nor is, you know, would anyone be willingly. Going back to the China and human rights violations and all that, it wasn't just being dragged out of your home. You had checkpoints, you know, on your way to work. You might be stopped 3 times to have your temperature taken. When you go into your work, your temperature is taken. When you go into the grocery store, temperature taken. Go into the airport. So how many people with the stereotypical paranoid American would subject themselves to willingly being thermometized? What's the right word for that? Scanned.
Pretty sure it's not thermometized.
Scanned 7 times a day, let alone once.
I don't know. With someone with anxiety, I'd be on that train pretty quickly. Like it would ease my anxiety a lot to, you know, get tested to make sure that I didn't have a fever, you know, but that's just me.
As a hypochondriac, I can safely say no, that would do nothing good for my anxiety.
But you wouldn't wonder, like, anytime that you got hot, be like, oh, fuck, do I have a fever? Let's go get my temperature taken to, like, confirm that I don't? That wouldn't be a sense of security for you?
I don't think so, because, you know, the human temperature, everyone says, you know, it's 98 point whatever, and it stays there, but it could be off by a 0.01 or whatever. It can fluctuate a little bit, depending on a lot of different situations. So, and, you know, I tend to run warmer than you. So that would be awful, knowing like every checkpoint, like your temperature is off by 0.02 degrees. And the first thought is, what does that mean? And then the rest of the day is anxiety. So no, same reason, you know, we were talking about getting, you know, Fitbits to get those little steps in, you know, like, oh wait, heart rate monitor and check my sleeping and everything else. Like it would be an obsession every single day. Like, okay, where's my heart rate at now? Oh no, my heart rate went up by 2. Let me check again. Now it's up by 5, and it's a never ending spiral.
We are getting through this a lot quicker than I anticipated. Like, the amount of research I've done over the last 48 hours would not line up with how quickly that we're moving through this information. But do we want to hop on the conspiracy theory train and talk about those?
Yes, please.
So we're going to start with the easy ones that I'm pretty sure we can debunk fairly easily. One of the ones is that vitamin C can cure the coronavirus. Unless you have fucking scurvy, it's not going to do a damn thing for you. So we can throw that one right out the window. Same thing with sesame oil. It's not going to do anything for you. This is one that I heard today when my mom dropped by, that her fiance told her that he heard and wholeheartedly believes. So Charlie is way more political than I am. So what she told me that she heard is that every time there's an election, we somehow have a pandemic.
I mean, that's a standard political tactic right there, right? You know, you cause one problem over here, get everyone's attention on that, and then you look away. But I strongly discourage anyone to go into that territory, because that very quickly becomes like the There's a couple people that are facing lawsuits for the Sandy Hook deniers who are, went up to these parents and told them that their kids didn't really die.
Yeah, that's
so anytime something like that happens, it's fine to believe that, and it's fine to discuss it, but you also have to remember that these things are real for everyone else, and you have to be very sensitive about those sort of things. So it wouldn't surprise me, but to just say, there was a senator, I posted the tweet for senators are picking that up and saying that there's a potential that this is like a man-made virus for Hong Kong and all that. So it flies around, but that's mostly a political tool rather than a reality.
So I am a little more trusting of our government than Charlie is. So how do we feel about China releasing the Wuhan virus from a lab, like how it's like man-made? How do you feel about that?
I'm going to go ahead and say it's bunk. I mean, we've seen lots of things similar to this, and people compare it to SARS and like the stuff that comes from bats. So is it possible someone like got these pangolins?
I don't fucking know. I don't know how to pronounce it either.
Harvested their meat and tainted it and then planted it. Sure, I guess that's possible, but this seems like it's more of humans brought it upon themselves by shoving a whole bunch of animals in a market next to people than it is someone intentionally created it and released it. And those sort of conspiracies have been around forever. Back when Bush was in office, one of my favorite conspiracies that flew around was that he summoned Hurricane Katrina. Just the sheer ridiculousness of it.
That is the first. I haven't heard that one. How have I not heard that?
Yeah, that one was really popular for a while, and some of those conspiracy theories, 4chan, we are on to you. They like to just come out and troll people. You create conspiracy theories to tell conspiracy theorists how stupid they are, but inevitably people jump on board with it. So, yes, the government can control the weather through HAARP, but that doesn't mean that President Bush stood out on the levees and summoned a hurricane.
So China shooting people to prevent them from escaping the quarantine zone.
Like I said, I researched that one, and a lot of the stuff I saw was actually bunk, that it was someone who caused like an auto crash and some other things.
Not to mention that it's Chinese New Year. Lots of fireworks.
But it's definitely within the realm of possibility. Right. So I'm going to say, what Mythbusters used to do, they used to do like bunked, true, or plausible. We're going to go with plausible on that one.
That's fair enough. All right, so the big one, 100-year pandemic. So give me your spin on it, and then I'll say my piece.
Okay, so I spent a lot of time researching this one today. And I mean, there is some truth to it in the sense that there have been some major plagues, outbreaks, diseases. In the 1700s, you had the bubonic plague, which, if you didn't know, still exists to this day. Fleas and rats are carriers of it. In fact, I believe Arizona or Nevada, one of those two, has like 2 or 3 confirmed cases a year because it's still there. We just have a way of dealing with it now. Then the 1800s brought around cholera outbreaks, and then the 1920s was the Spanish flu, and then now in 2020 we have the coronavirus. So no conspiracy on the front of it actually happened. So we can confirm those 4 things did happen. Is it on an actual time frame? No, I don't think so. Is it something supernatural? Is it a warlock in a tower who's got a 100-year curse on us? I don't think so. There's a couple logical explanations, but I'm going to first start with my most favorite explanation, which actually comes from a Star Trek episode.
You have no idea how excited he is to quote Star Trek. You just
very excited for Star Trek. So Star Trek Season 5, the season finale, and Part 2, which is Season 6, Episode 1, Time's Arrow. The crew goes back in time to the 1800s, and they find a whole bunch of people dying of cholera, which, of course, as we just talked about, was happening at that time. However, they discovered it was not cholera. Rather, it was magical aliens from another dimension that were using a snake staff to travel through time and space to steal our cerebral fluids to feed their civilization. So, even Star Trek is on board with the 100-year curse in a way. more logical than that, a lot changes in 100 years.
Absolutely.
Transportation, exploration,
medical stuff.
Yeah,
we're not bloodletting anymore.
There's no ghosts in your blood cured through cocaine.
Oh, did you see that meme that I posted in our Discord? Yeah, I thought that was beautiful. I loved it.
So the more likely explanation would be when you have a group of people who've never been introduced to viruses or anything like that, and they meet an indigenous people or another group of people, and they've never met and they've never shared their diseases, the first thing that's going to happen is they share their diseases with each other, and both sides are devastated by these new problems. So it was probably a combination of that sort of thing, the exploration in new diseases that cause these things to pop up, as well as modern medicine can stop these things more often than not.
We understand the human body better.
Yeah, the hand washing things. In fact, there's a random tangent about this. There's some parts like of the Bible that talk about hand washing and cleanliness. And so there were whole cities who were very religious that avoided the bubonic plague and other such plagues because they had the hygiene standards that other civilizations and groups may not have, and were very, hated for not getting those sort of things. But that hand washing alone, hand washing might be the single greatest medical breakthrough that mankind has ever discovered for preventing disease and preventing the spread of disease.
Who would have known? Being hygienic.
So, your take on it, because I want you to know I shared this information with Emma Strange. I was very excited to tell her that there may be some truth to this, and she immediately shoots me down and says, no, you're dumb. So, let's hear it.
Not in those words. I was like, no, there's absolutely no foundation for this. Like, none at all. So, I'm going to go a little bit more in depth than Charlie here, and we're going to talk about the history of... we don't have time to talk about the millions of epidemics and pandemics that we've experienced since we've, as a human race, have been able to record. So, as Charlie said, so in 1520, we did have a plague. 1620, we had the bubonic plague. A lot of people have suggested that this actually began in 1616 and ended in 1619. But it was a combination of yellow fever, smallpox, typhus. But recent studies suggest that it was more likely to be, and forgive me if I butcher this because I have never heard of this before, but leptospirosis and Wells syndrome. So it's estimated, based on what records we were able to pull from historians and stuff, that it's estimated that 30 to 90% of the population in the 1620s in the area that was affected was wiped out. So that is that. And then we have in the 1720, plague, the Great Plague of Marseille, also bubonic plague. It arrived on a merchant ship called the Great Saint Antoine, which was carrying infected passengers they'd picked up during a journey to the Middle East. It was spread by infected rats. They had plague walls that were built to try and quarantine the disease. Obviously, that did not work. It spilled over into France, and then it tapered out about 2 years later in 1722 and killed about 100,000 people. So, so far we have a trend. 1820 with cholera actually began in 1817 and ended in 1824. The total deaths from the epidemic of that remain unknown. 1918, Spanish flu, also known as, we all know, the 1918 influenza pandemic. Evidence suggests that it started earlier than 1918, but wasn't actually reported in Spain until 1918. And a lot of evidence suggests that it actually didn't begin in Spain. It's just when information started being recorded. Estimated death toll as of 2005 is between 50 and 100 million. Again, we don't have the best record systems the further back you go as far as dates. Let's see. What else do we got here? Cholera, Spanish flu. The Spanish flu pretty much killed more people than any pandemic disease before or since, according to historians, including the 6th century plague of Justinian, more than the medieval Black Death or the AIDS epidemic or Ebola. So, and then of course you come into 2020, we've got the coronavirus. And like we said at the beginning of the episode, at the time that we're recording this, there have been around 94,000, a little bit above, reported cases of COVID-19 globally. Of those reported numbers, and again, these are numbers that are based on the time that we looked at them, so it could be above that now, but only 3,214 have died, most of which have been in China, Iran, Italy, South Korea, while as of right now, we only have 8 deaths here in the United States. Most of those are people who are elderly with compromised immune systems. So that's the timeline that people are saying that we're getting plagues every 100 years. So if you look just at those and nothing else, of course, you're going to think that that is what's happening. But it's not. So debunking it. Pandemic. So we're going to go over. It's a little bit of a lengthy list, but this is not every epidemic that has happened, just ones that I wanted to highlight to prove my point. So outside of the 100-year conspiracy, we had the Plague of Galen from 165 to 180 AD. Scholars believe this to be either smallpox or measles, estimated about 5 to 10 million deaths. The Justinian Plague in 541 and 542 with an estimated of 25 to 50 million deaths, so about 40% of the population in Europe, Egypt, and West Asia. We had the infamous Black Death in 1331. It tapered off about 1353 after about 20 to 200 million people, which is a broad range, I know, but again, it's 1330s, so 20 to 200 million people in Europe, Africa, Asia, which was more than half the population at the time. This was a disease. Wow, what was that? I don't even. Was a disease a lot of medical physicians tried to combat with bloodletting, lancing, all that really hardcore medieval stuff. We have the leprosy outbreak in the 11th century. Of course, that had been around prior to that date. However, it grew to pandemic levels in Europe during the Middle Ages. 1957, we had the Asian flu, which continued through 1958 with a total of 1.1 million deaths globally. 116,000 deaths of those were in the United States. 1545 to 1548, Salmonella outbreak in Mexico killed about 5 to 15 million, which was about 80% of Mexico's population during that time period. Salmonella. So we look at the 20th and the 21st century pandemic. So obviously we have the 1980 Spanish flu. That's the big one. And then a lot of us who are probably listening to this podcast have lived through the Ebola outbreak, like the big one that happened between 2004 and 2016. We had 11,000 confirmed deaths across West Africa, primarily in New Guinea, Sierra Leone, and Liberia. 1981. HIV and AIDS. As we know, there's no cure for it, and about 35 million worldwide have died since its discovery. 2002, 2004, we touched on this earlier. The SARS outbreak across China, Hong Kong, and then lesser known Taiwan, Canada, Singapore. And then 2009, which, as most millennials know, the H1N1 swine flu. We had about 203,000 deceased people worldwide due to the H1N1. As of 2019, the present Democratic Republic of the Congo had a measles outbreak with a death toll of around 6,000. It's still kind of going on. And then as of last month, also in the Democratic Republic of the Congo, they've had 2,253 deaths attributed to the a different strain of the Ebola epidemic called the Kiva Ebola. And that is still going on over in the Congo as well. So as you can see, it's not just every 100 years. Not by a long shot.
Yeah, definitely not. So you are right. You get a point.
Just one point. You know how freaking long it took to research all this shit? So much. If you select the data points yourself, of course, you can find a pattern. Of course,
absolutely.
Look at
all the data, obviously, it doesn't support it. Another cool story, since we're talking about plagues and stuff, there's a story that floats around like the essential oils community and such.
Oh my God. Okay.
Thieves oil. You heard of it?
Yeah, I know what it is.
So it's kind of a cool story. Whether or not it's true, who knows? But I like the story. So essentially, these 4 guys during the plague times were going around and robbing houses and not getting sick while they were, stealing literally from people with the plague, going into their houses and taking their possessions. And the story goes that they were caught and their sentence was reduced, gotten rid of, or however, if they would tell how they did not get sick. And essentially the idea was kind of the plague doctor mask. They took this mask and they stuffed it full of antibacterials or antiviral or antiseptics, things like that. Essentially this a blend of oils that killed airborne viruses and kept them safe from catching it, because it was an airborne sickness at the time and they were killing it with their masks. So probably not 100% true. I'd highly doubt it, but it is a cool story and it smells good.
Fair enough. So are there any other points that you wanted to touch on surrounding all of this?
No, I think we got the main things we wanted to touch on.
Because I know I wanted to talk about like health advisories and survival and stuff like that, but if there was anything else related to what we were talking about just now.
No, I think we're ready to move on. Okay.
So the main thing I want to say about this is you guys have got to stop buying all the masks and the personal protective equipment. If you're not sick, if you don't have a compromised immune system, and if you are not caring for someone who is ill, you do not need a mask. You're causing a shortage for health workers if you are buying all of this personal protective equipment. And if you don't know what items qualify for that, let's see. You don't need gloves. You don't need medical masks, goggles, gowns, aprons, respirators, any of that. Please stop hoarding it. You don't need it. All you need to do is wash your hands. And it's really easy, like so easy.
Can you take us through the steps, please?
Of washing your hands? You should have learned that shit in kindergarten.
Please demonstrate.
Well, you need to do it for at least 20 seconds. How long do you wash your hands?
I would say probably longer than that.
Okay, well then see, you're fine. You're fine. I was always told to sing the alphabet while I wash my hands, and that's long enough.
I'm not going to take that advice. I work with other people, and if they come into the bathroom while I'm washing my hands and singing the alphabet, that could be...
Yeah, I suppose.
But asterisk on what you're saying, of course, keep up to date on the news. If the CDC or anyone else announces that they do recommend that, of course.
Oh, yeah, absolutely.
Our statements do not override the CDC or medical professionals. So if that updates after this episode, feel free to ignore us and do as they recommend.
Charlie just doesn't want us to get sued, is the bottom line there.
Boilerplate.
Mm-hmm. So, it's just basic hygiene, my dudes. You should be doing this anyway. You don't need a pandemic to happen to wash your hands. If you're not washing your hands before you eat or after you wipe your ass, you kind of got bigger problems to deal with than this. So
I think a study just came out and it popped up on Twitter, so not verified, but they said that out of a poll of like 1,000 or 2,000 people, 35% of men wash their hands after going to the bathroom and 60% of women wash their hands after going to the bathroom.
Yeah, that doesn't surprise me.
So
it really doesn't.
To quote the famous meme, those are rookie numbers. We need to get those up.
Yeah, just a little bit. And if for some reason you can't wash your hands because you're out and about, use hand sanitizer. In the video that we listened to earlier in the episode, they said 60% proof. Is that what 60 proof or 60%?
60% is what they said. But they did also say proof, which with alcohol, that's like the half, so 30%, 60 proof. So I don't know if they actually meant proof or if they meant...
I think it was just poor language because one of my doctor friends, when I worked for the hospital, I texted her a couple days ago and she said, realistically, it needs to be 60, but it's better if it's 80% alcohol in your hand sanitizer. So just, I don't know,
So
between
get that
60 and 80.
moonshine.
Let's see. Sneeze, cough into tissue or into the corner of your arm. It's better if you're wearing sleeves, but if you're not, it's whatever. Wash your arms. You can easily wash and disinfect your clothing. But basically, in summary, these are things you should be doing already. Disinfect high-touch surfaces like phones, gaming consoles, light switches, your faucets, toilet handles, light switches, Jesus. Basically things that you touch a lot or other people touch a lot, door handles, stuff like that. And then please stay home if you're sick. I know, again, it's hard financially for a lot of us in the United States, but better safe than sorry.
Yeah, that's a whole nother episode's worth of content right there on which is better for society. You go to work and get people sick, or you stay home and not be able to pay the rent. That's a whole different thing of philosophy and morals, and we don't have time for that on this episode. But that is the official recommendation, it sounds like, so that's what we're going to recommend as well.
Again, if you're an Oregon resident and have questions, you can call 211. We don't have a coronavirus hotline yet, so we don't have one to call, so I can't give you a number.
I feel bad for the people working that. As someone who's worked in call centers in the past, I cannot imagine what being the coronavirus emergency response 211 representative would be like.
Yeah. Well, if we don't have anything else to say, I have a few show notes to add, but other than that, I mean,
let's do the notes.
Okay. So we're planning on having our Discord and website and Patreon up and running by the end of the month. I would like to have it up sooner, but that is the goal. We also have a giveaway scheduled soon, so we'll be posting bits of that probably primarily on TikTok and Facebook, mostly TikTok. We got this really adorable alien plush from Squishables. So cute. And then we ordered some stickers that we'll have, and then a couple other spooky goodies that you can get your hands on. So we'll release notes on that as it becomes available. We are planning on going to Scotts Mills this weekend, I think.
Yes, I was just going to ask if we could do the teaser for our first investigation is going to be the witches of Scotts Mills. We've been trying to gather some information on that, as well as potentially while we're in the area, we were talking a little bit about the hanging tree and the haunting of Mark Twain.
It probably won't be full episode content, but we will touch on that. If you are from the Oregon Silverton, Scotts Mills area, and you have information on those local legends, or local legends outside of those, we would love to hear them and compile them into, a full episode. I do want to say, because as Charlie has had to listen to me rant yesterday, I put the feelers out on social media asking, the public for information regarding that. And if you do not agree with paganism, that is A-okay. We're not asking you to agree with it or to understand it, but please be respectful, because that is very much a religion for a large part of our population, and burning witches at the stake is not an acceptable thing to say anymore. So just be respectful. Don't gotta agree with it, but gotta respect it. So Charlie has hopped on to the social media train. So if you want to give your social media things so people can reach out to you, talk to you.
Definitely. I do have a TikTok, but I'm not selling my face to the Chinese
He's not
government
dancing
as of yet. Mostly I am on Twitter right now. I've been covering the coronavirus as well as occasional paranormal things and Animal Crossings, because I'm looking very forward to that.
Speaking of, tomorrow Castlevania comes out.
Yes, Castlevania Season 3, if you have not caught up on that.
So good,
one of the best
good.
Netflix shows for sure. And you're in luck because Season 1 is 4 episodes long, and I binge watched that the day it came out, and then I had to wait and wait and wait for more episodes. So now you get 3 seasons to binge watch in one day rather than 4 episodes.
I feel like that's the same anthem for My Hero Academia right now.
Yeah. But you can find me on Twitter. I'm at Charlie Ripley 3. I'm the person with 3 followers, so I should be easy to find. And of course, you'll find in my follower list Emma Strange. You should follow her as well on Twitter, but she was mostly the TikTok side. So if you want
TikTok and Instagram, those are my
videos,
hunting grounds.
dancing videos, and that sort of thing, follow her.
I'm at graveyard I cannot talk today. Like, is that a side effect of the coronavirus? Because I am just like tongue twisting every damn thing I say.
We're gonna have to delete the episode and start over. Sorry, folks. Technical difficulties.
I am at graveyard _girl X. And like Charlie said, I'm on Twitch, TikTok, Instagram, Twitter. But if you don't use any of the social media platforms, we are also reachable at transcendenceparanormal@gmail.com. Like I said, our website is looking to be up at the end of the month, so we'll have show notes and photos and all kinds of goodies for you to look at. And yeah, and we'll also have a P.O. box here soon too, so you can send us weird shit to put on our wall.
I was actually just watching a streamer today do that. They had a P.O. box, and their rule is you can send me anything as long as it's not illegal. And
no body fluids. Also, now that I think about it, please no body fluids.
And
no panties
he
either.
Just gets the weirdest things, from the fan arts to the here's my 6-page script of me shipping you with someone else. Bad fan
what
fiction.
Streamer?
I was watching the Barbarous King. He's Mario Maker 2. So he gets all sorts of weird things in there. And you know, there's like the people who get like the mystery boxes and all those. So.
Mm-hmm. Which I have ordered a couple of those, and they take a little bit to ship and make, but we'll have some live unboxings, probably either YouTube. Oh yeah, we do have a YouTube, and we will be posting things on YouTube. So
and streaming games, hopefully someday. We're going to do horror games.
Well, someday. We have the stuff to do it. It's just trying to get Twitch to not be a bitch is the problem.
Well, the first problem is the 40-digit password to sign in.
Damn, I know.
That's the true final boss.
Speaking of streamers, I know we're trying to get out of here, but Logan Paul is on TikTok now. I accidentally saw today, and I've heard that his content actually isn't like for 20 boppers anymore, and he's got like some 5 o'clock shadow going on. Like, he doesn't look like baby Logan anymore.
So I think that's now referred to as like glowing up or Biebering, because Justin Bieber apparently has very much changed over the years as well.
I love how you sound so much like a 60-year-old man.
I like to channel that. That is my spirit animal.
Not even 30 yet. It's just, I believe that's called glowing up.
That's what the kids call it these days.
Jesus. All right, guys. So we are getting to the end of our time slot here. So we're going to play you our really sexy outro music. So if you have ghost stories, we would love to hear them. You can shoot those to us at transcendenceparanormal@gmail.com. We would love to hear from you, and we would love to feature them on one of our episodes. So yeah, stay healthy. We love you. You are magical. You are valid, and you are loved. Stay spooky. Have a great night, guys.